1. What are the side effects of local anesthesia? A. Tissue irritation. B. Loss of consciousness. C. Irreversible onset. D. Loss of sensation. The correct choice is D. 2. The basic structural unit of the nervous system is the A. Neuron. B. Osteon. C. Sarcomere. D. Keratinocyte. The correct answer is option A. 3. Efferent nerve cells are distinguished by which characteristic? A. A thin nerve membrane encases the axon. B. The cell body provides metabolic support for the cell. C. The cell body lies directly between the axon and the dendrites. D. Free nerve endings form a tree-like arrangement in the dendritic zone. The correct answer is option C. 4. Which cellular component is critical to nerve conduction? A. Nucleus. B. Axoplasm. Circa axillema. D. Myelin sheath. The correct answer is option C. 5. As it travels along a nerve fiber, the strength of an impulse, A. remains constant. B. rapidly increases. C. steadily decreases. D. gradually increases. The correct answer is option A. 6. The firing threshold of nerve excitation is characterized by A. slow depolarization. B. rapid depolarization. C. gradual repolarization. D. reversal of electrical potent. The correct answer is option B. 7. Local anesthetics produce which effect on the nerve membrane? A. Less sodium is required to achieve repolarization. B. More sodium is required to achieve depolarization. C. Less potassium is required to achieve depolarization. D. More potassium is required to achieve repolarization. The answer is option B. 8. The combined depolarization and repolarization of a nerve membrane takes A. 1s, B. 0.7s, circa 1 millisecond. D. 0.3 milliseconds. The answer is option C. 9. Which statement is true? A. Nerve membrane channels expand momentarily during depolarization. B. Chloride ions are too large to pass through resting nerve membrane channels. C. Membrane channels are external passages located outside the nerve membrane. D. Sodium channel gates are located near the internal surface of the nerve membrane. The answer is option A. 10. Which prevents retrograde, backward, impulse propagation? A. Ranvier nodes. B. Refractory period. C. Membrane channels. D. Saltatory conduction. The answer is option B. 11. A neural impulse travels A. rapidly in myelinated nerves. B. sporadically in unmyelinated nerves. C. by leaping from node to node in unmyelinated nerves. D. by adjacent depolarization of nerve membrane in myelinated nerves. The answer is option A. 12. In order to inhibit impulse transmission in a myelinated nerve, the anesthetic solution must cover how many millimeters of nerve fiber? A. 1 to 2. B. 3 to 5. Circa 6 to 7. D. 8 to 10. The answer is option D. 13. Which phase of the action potential is most profoundly affected by local anesthesia? A. Resting. B. Repolarization. Circa slow depolarization. D. Rapid depolarization. The answer is option C. 14. Which theory is most widely accepted to explain the mechanism of action of local anesthesia? A. Acetylcholine. B. Specific receptor. C. Membrane expansion. D. Calcium displacement. The answer is option B. 15. Most injectable dental anesthetics bind to receptor sites at which location? A. Activation gate. B. Inactivation gate. C. Within the sodium channel. D. On the outer surface of the sodium channel. The answer is option C. 16. Which is the first step of anesthetic action? A. Impulse conduction obstruction. B. Reduced rate of electrical depolarization. C. Displacement of calcium ions from the sodium channel. D. Attachment of the local anesthetic molecule to sodium channel receptor sites. The answer is option C. 17. Which is true with regard to the pH of local anesthetics? A. Epinephrine-containing anesthetic solutions are acidic. B. Anesthetic solutions that do not contain epinephrine are basic. C. Alkalinized anesthetic solutions produce a burning sensation on injection. D. Highly acidic anesthetic solutions produce a rapid onset of anesthesia. The answer is option A. 18. Which anesthetic solution facilitates the most comfortable and effective injection? A. 3% mepivacaine HCl with a pH 4.5. B. 0.5% bupivacaine HCl with a pH 6.5. C. 2% lidocaine epinephrine with a pH 3.85. D. 4% articaine HCl epinephrine buffer with a pH 7.35. The answer is option D. 19. In the presence of tissue inflammation or infection, local anesthesia is A. Nearly twice as potent. B. More rapidly achieved. C. More difficult to achieve. D. Likely to spread the infection. The answer is option C. 20. Which is the primary diffusion barrier in a peripheral nerve? A. Fasciculi. B. Paralemma. Circa epineurium. D. Endonurium. The answer is option B. 21. Each is true with respect to mantle bundles. Except one. Which is the exception? A. Found near the surface of the nerve. B. Exposed to a high concentration of local anesthetic. C. Blocked completely, soon after an anesthetic injection. D. Innervate the most distal tissues of a nerve distribution. The answer is option D. 22. Induction time spans from A. Conduction blockage to complete repolarization. B. Injection of anesthetic solution to conduction blockade. C. Excitation of a nerve segment to the attainment of firing threshold. D. Termination of an action potential to the restoration of resting potential. The answer is option B. 23. Which factor is linked to the potency of a local anesthetic? A. Lipid solubility. B. Extent of protein binding. C. Dissociation constant, pKa. D. Diffusibility through non-nervous tissue. The answer is option A. 24. Which statement is true with regard to recovery from local anesthesia? A. Recovery from anesthesia occurs more rapidly than induction. B. Core bundles remain anesthetized for longer than mantle bundles. C. Steps for induction and emergence from local anesthesia are identical. D. Mantle bundle fibers begin to gain sensation before the core bundles. The answer is option D. 25. Which reduces the duration of anesthesia? A. Tachyphylaxis. B. Decreased vascularity. C. Increased protein binding. D. Addition of a vasopressor. The answer is option A.